So, the government's plan is to bring in 2,000 more doctors to deal with the shortage in key healthcare areas and in the countryside. They say it's because South Korea doesn't have enough doctors compared to other developed places. But the truth is a little bit different. Even though we have fewer doctors, because there are so many people living close together, it's not hard to get medical care. The real problem isn't how many doctors there are, but how little they get paid. Some procedures barely pay enough to cover the costs. So doctors have to make money from things that insurance doesn't cover, like room fees. And this is okay for patients, but tough on doctors. Because of this, cosmetic surgery is really taking off in Korea. Doctors are looking more at what they can earn and their quality of life rather than the honor of the profession. Hard jobs like orthopedics, emergency, and cardiology don't pay well for the amount of work. And these doctors hardly ever get home to be with their family because of night shifts. Pediatricians not only get paid less, but also have to deal with demanding parents, which is really stressful. Surgeons and doctors delivering babies face the threat of lawsuits that could cost them a lot, even when they don't earn much. The main issue isn't that Korea doesn't have enough doctors, it's about where these doctors are and how much they are paid. But talking about raising doctors' fees is hard because people think doctors already make a lot of money. So it's tough to change this without challenging that belief. Even knowing this, the government wants more people to go to medical school to look good in the public's eyes. But doctors see this as a move that could hurt basic health care. Becoming a specialist takes a long time, up to 16 years. When you consider all the schooling, training, and for men, military service, just adding more medical students without fixing the support for essential health care doesn't really solve the problem.
There are several reasons. First, doctors are worried about what they've seen happen to lawyers. After the bar exam was abolished, the number of lawyers surged, leading to reduced treatment and salaries for them. Doctors fear that if the medical school quota increases, a similar situation might occur. More supply could mean lower salaries, harder job searches, and a diminished stature for doctors. Second, doctors working in the field feel that there are already enough doctors. The situation is such that there are more doctors in popular areas than needed, and if medical school quotas increase, competition will intensify, and the costs of uninsured medical services might drop. Third, the perspective is that simply increasing the number of doctors without addressing the current issues faced by the medical sector, such as the shortage in essential medical fields or the treatment of specialists, is opposed. Lastly, a significant reason is that the current infrastructure is not adequately prepared to educate an increased number of medical students. There is a shortage of teaching staff and educational facilities, making it a problem that cannot be solved by merely increasing the quota.